Hey there, guys. I'm Steffi Steph, and this is Bobby, and this is a special episode of Between Two Teeth. Bobby, who do we have here today as a
We
guest?
have Mr. Drew Eason, who's the executive director with the Florida Dental Association, and we are so welcome.
Welcome, Drew.
Welcome.
Thank you.
Drew and I knew each other from a long time ago when he was kind of our student liaison with the Michigan Dental Association when I was ASDA president a long time ago. So we've known each other through the years. Love what you're doing down there in Florida. But we have a very specific topic we're talking about. We're going to talk about how do we make others feel welcome in organized dentistry. How do we do it?
A great question. I like to talk to people about it. You start with the small stuff. We look at things like Toastmasters and having as people who are assigned. So you have your local dental society meeting. I think a good way to make sure that it's a welcoming meeting and people feel welcome is you've got somebody who's stationed at the door who's there to welcome everybody, check them in, make sure that they're introduced to folks so it doesn't seem so cliquish. And having the right person doing some of those jobs. I remember years ago, went to a local component meeting, and a brand new dentist came to the meeting. She hadn't been there before. She thought she had paid her dues, but apparently she hadn't. And so when she went to check in, her first response was, "Well, you haven't paid your dues yet." And she said, "I thought I did." "Well, you didn't. You can't come in until you pay." And she was all embarrassed. She actually turned around and left. I followed her out to the parking lot and apologized on behalf of what had just happened. And we were able to fix it down the road. But it's making sure that people understand how just to be nice up front. That's an extreme example, but those are the kinds of things we have to watch for. And if we see those things happen, we have to make sure we fix them.
That's not that uncommon. That actually happened to me in our local dental society. They wouldn't let me come in to the meeting. I had
And
to
now I'm gonna pause you
ticket.
there. That's true, and you're not a new dentist who doesn't know how to pay their dues either.
I just walked in. I was like, yeah. Anyways,
I think the cool thing about what you just said, Drew, is you kept in mind the big picture. Yes, it's good to pay dues. Yes, we do need to make sure we're paying them. But the big picture is we want membership. We want to increase our membership, and we want to make people feel welcome. It may not be exactly the road that is laid out before us, but it's okay if we kind of get there eventually.
Making people feel welcome. How do you feel welcome if you walk into an event?
Right. This is where I got to give a shout out to Dr. Tommy Harrison. Sometimes at the very beginning of a new meeting, especially like when you don't know what's going on, Dr. Tommy Harrison has a way about him that is spectacular. And what I mean by that is he does similar things to what you're doing there, Drew. He gets the big picture. It's not necessarily about getting things done as efficiently as possible or maybe connecting with the most powerful people in a room. Tommy Harrison will connect with anybody. And what that means is even if you are someone new like me who is not that powerful, he'll still come over. He'll tell you, "Hey, this is what this work group's doing, and this is why we're doing this." And he could absolutely be talking to people way more important than me. But
Tommy's a great example. We had a charity event raising money. We had a Elvis impersonator, or maybe it was the real Elvis, in our building. It was something for Texas Mission of Mercy. And Tommy's talking to the dental students. And it was so meaningful to these dental students. And Tommy's on the faculty at Houston. These dental students were from the Dallas school. And it was meaningful to them in so many ways. We got to do more of that. We have to reach out. I think it's got to be an individual to individual type of situation where people do feel welcome. And it's the leaders that need to do that.
Yeah,
the leaders
everybody
have to be trained. Everybody has to be trained on stuff that they don't think about. So one of our past presidents here, you might know her, Dr. Jolene Paramore.
Yes, I love Jolene.
Really good. Yes, at meetings, we would have meetings, and she would acknowledge the new people, make sure everybody knew who they were. And then when somebody was giving a report, and they would say, "Yeah, I was at the CDEL meeting last week." She'd go, "Oh, wait, hold on a minute. Could you explain what CDEL is?"
Oh, that's awesome.
"Oh, yeah, it's the Council on Dental Education and Licensure," because new people don't know what you're talking about. We all get caught up in the acronyms and assume everybody knows, and they're lost. So to what you were just saying, sitting down and explaining to people what's going on, or even letting them know in advance, what's the dress code? What can you expect when you come to this meeting. It makes it a lot easier for
A quick
folks.
thing on Jolene Paramore. So Rudy Liddell had actually connected. I was part of this Harvard Surgical Leadership Program, and my capstone was on access to care issues. And specifically, I was going to use our Texas Missions of Mercy as an kind of one of the examples there. And of course, Rudy's like, Florida moms, we got this too.
Yeah.
And apparently, Jolene and a bunch of other great folks had actually had a JADA publication on something very
Yes.
similar. And, one of the
Mm-hmm.
things I'm learning is there's really very few original ideas. And so Jolene got on the phone with me that very night and spent, I mean, well over an hour just walking me through, hand holding, explaining to me so many of
Yeah.
the kind of known issues on access to care. I loved it. She did a phenomenal job with that.
Yeah, she's a great mentor in those things.
Helping others, taking your time to help
Mm-hmm.
them.
Yeah.
I think another thing that I'm going to pivot is getting your messaging out there. I like the
Mm-hmm.
Florida Dental Chatter. Is that the official name?
Yep, Florida Dental Chatter. That's our
You
Facebook
guys
page.
do such an awesome job that I haven't. Other states are not doing things as well as that. The information you put out there, the camaraderie, especially because it's a pretty large group. And I love that you put questions out there. That's part of why we're doing this, was based on that one question.
Right.
What do we need to do better in organized dentistry? Frankly, I think, there's a lot of competition out there. We have a
There
study
is.
club. We have a study club where we have a blue couch in our office where people come and hang and have a glass of wine or tea or water before the meeting, and we talk about life. We talk about life. We talk
Right.
about practice. I think DSOs are going to continue to evolve and do a great job at reaching out to their member dentists that participate. If we don't change what we're doing and how we're doing it, it's going to be a big problem.
I would agree. And speaking of DSOs, when we're talking about making even students welcome, we do receptions with DSOs. And I'm sorry, we do receptions with the dental schools, with ASDA groups and things like that. We've been partnering with some DSOs, like we did one not long ago with Pacific, where the reception was sponsored by the Florida Dental Association and Pacific.
Yeah.
And some people say, well, why would we do that? Well, because students have choices. So wouldn't we want to have both DSOs there talking about the advantages and things of working for a DSO? We had private practitioners talking about that. It was great, and we were kind of working on that one together.
That's fantastic.
As dentistry continues to evolve, I think all of us have to be open to change. We have to figure out, realistically, what got us here will not get us there. That's one of the books that I really love. That's a really tough book to go through. But we need to be open to change. We need to be open to new ideas. Part of what we try to do Between Two Teeth, or with Between Two Teeth, what do we try to do?
We are about, or our purpose is to connect, discover, and inspire. And you mentioned the Blue Couch earlier, so that was kind of the platform or the springboard for us to start this YouTube channel. That and Zach Galifianakis's what is it, Between Two Ferns on YouTube. I don't know if you've
We're
seen that before,
slightly
Drew.
lower. We're lower budget
It's very
without the ferns.
quirky, and it's you'll have to check it out, at least one of the
I
episodes.
will.
And yeah, and so what we wanted to do was live out our YouTube channel's purpose of connection, discovery, and inspiration, and do that kind of in a way that we do with the dentists in our study club on the Blue Couch. And the reason it's Between Two Teeth is, ironically, it's not about the teeth at all.
Yeah.
Right. It's about everything else. And, you talk about how important it is in how you talk to people. So you hear this a lot, and I hope this is starting to change, but you'll hear a lot from people who work for DSOs that the reason they don't belong to organized dentistry is because they're not felt to be made welcome because they work for a DSO. I've been to meetings where a dentist comes in, somebody will say, oh, well, where do you practice? I practice for XYZ DSO down the street. Oh, well, you won't be there long. And they just take it down a negative path. That's the opposite of welcoming.
Yes.
It's not really a good start. Yeah.
Oh no, couldn't agree more. And that's where just when we look at new dentists especially, we have plenty of new dentists that are shadowing, or pre-dental students that are shadowing in our office. And man, the worst thing I think you can do is hit them with all the negativity right off the bat. Instead, just
Right.
think of something positive. Yes, there is a good hard truth there in there somewhere, I think. And there's also a lot of room to be encouraging. I think someone with a positive mindset will probably go further and perform better than someone who is being kind of doused with negativity. Oh, you shouldn't work there. Oh, you'll be done with this place in a week. Oh, this is never going to
Exactly.
work for you.
How about just listening to their experience is a better way? And when you talk about trying to be welcoming and accommodating, sometimes it's looking at structures. So over the years, I've seen maybe a local study club or a component somewhere in the country where they only meet Tuesday nights they have a cocktail hour from 6 to 7, dinner from 7 to 8, and a speaker from 8 to 9. And it's every Tuesday or one Tuesday a month, and it's always been that way. And somebody might say, hey, you know what? I can't do Tuesday nights ever because that's my son or daughter's this or that. And they're like, well, I don't know what to tell you. That's when we do them. It's on Tuesdays. Without even having the conversation, it might be like, maybe we mix it up once in a while. Maybe the format of a cocktail reception, dinner, and speaker isn't always the best way to do. I'm not saying don't do that ever, but maybe mix it up a little bit. Maybe you start with the speaker so people can hear that, and if they can't stick around because they got children and need to do homework or whatever, that they can leave. Looking at just different ways of how you do things that are always the same.
I would
Love
agree
it.
with that. COVID did a lot of things. It created a lot of change happening all at once. Post COVID, things are very, very different. People have lots of options out there. And if we do not have a unified voice through organized dentistry, we are going to have some really big problems. And I think
Yeah,
people that sit back and complain about this or this or this, if you're not involved, you shouldn't be complaining. You got to get
right.
involved. And when you show up to these meetings, you got to figure out how to bring people in. I think most local dental societies would be served well with the pre-meeting for the leaders and say, okay, remember, you got to get out there. We don't want you standing around in your little cliques talking to your little chummy chums the whole time. Get
Yeah.
out and see people. When I first came down to Dallas, I was as the president and then did a residency. I didn't feel welcome when I would walk into a meeting because I didn't go to the local dental school.
Mhm.
I didn't know people, and I'm kind of an extrovert, but I didn't feel welcome. And so
Yeah.
it's always kind
I
of
laugh at
given
that
me a
too, Drew.
push to look at things and say, well, let's reach out. And I think you do this really well because people want to talk to you. If they find out I'm on the state board, they don't want to talk to me at all unless it's a really bad problem. But you do good at reaching out to people, and we just need more of that.
Oh,
Mhm.
and
I would agree.
Drew, for question to you, for state dental associations, what's the one thing that we need, or just state dental associations as a group need to start doing if we're going to see increased membership?
Yeah,
You
give
know,
us the
that's the
answer.
question.
We'd like the answer.
Yes, please.
We're
That's the
waiting.
You
question
see, you seem like
everybody
you know
wants.
the
Yeah.
answer, so
We'd like
I wish I knew the answer. I wish I knew the answer because it's challenging. It's there's so many levels to organized dentistry, and I'm a huge advocate for the tripartite. I think if you didn't have that and people could choose one level or the other, everybody loses then
yeah.
because it would be so divided up. So I think that that's a key. I think what we're talking about right now is going to be the key for everybody at the state, at the local, and at the national level. It's how welcoming are we truly, and how responsive are we to requests? I mean, we have to be top notch in our customer service and our relationship building. I
mm,
want people in Florida to think I don't want to quit because so and so I'll feel bad because I know I work with that person all the time, whether it's somebody at the state level or the local level. To me, it's all about relationships. We don't sell widgets. We sell relationships and we're problem solvers, but we don't have a product that we're shipping to you. So I think those relationships are key. And the more we can have personal relationships, the better.
and I'm going to push it one step further. Last night at our Seattle Study Club meeting, the topic was kind of on relationship building, and there was one line item in there talking about different generations and communication with different generations. How would you speak to the differences if you are trying to build a relationship with a millennial or Gen Zer versus a Gen X person?
Yeah. So in my head, I'm still the same age I met Bob back when he was in dental school. So when I'm talking to a millennial, I still feel like I can just hang out with them.
Aw.
I think sometimes we over stress. We have to acknowledge that there's differences there, but it's like when people make a joke and say, "Oh, anybody over 50 doesn't know how to use technology. They need a young." Well, that's not true anymore. I mean,
Yeah.
my dad's 85 and he's very adept at that. I think we just need to be inclusive and listen. I mean, we have to remember to listen and not just make assumptions. So I may not agree initially with something, let's say a millennial's talking about, but I'm not going to fall into the stereotypes you hear all the time about millennials don't want to work. Because my kids, and I have twin sons, they're almost 28 years old, and they don't fit any of the molds that I hear people talking about negatively about young people. I think this when I go to the dental schools now, they're engaged, they want to be involved, they're fun, they're willing to do silly stuff with us on social media, and they're willing to do the job. And I think we just have to stop stereotyping each other and just start working together.
Love it.
That's a great message. And on the social media front, I think you do it well. I think Florida Dental Association and through the chatter do it awesome. You've got to try different things. There's different messages that are going to work for different people. Once again, that's part of why we do this. We're like, let's just get something out there. We have a real passion to do things. I have a passion to push people, and I want to push people. I want to push change. And this is a venue for that. And I think we just have to keep looking for ways that we can.
And you just said something I think I agree 100%. Is try stuff. Just try it. Yeah. If this dental chatter thing we try just to see. Let's push it a little bit. Let's see if we can get it going. How many people are interested? It's another way. It seems to be working, so we're going to keep it going. And some things don't work, and we just stop doing them and try something new.
I love it.
What I tell my boys, if you are not failing at things, then frankly, I don't think you're trying hard enough. You have to expect to fail. If you're not failing, you're probably playing it too safe. It is okay to fail. I have learned so much, unfortunately, through failure. I've learned an awful lot because I failed a bunch. I haven't learned a whole lot from succeeding at things. So
yeah.
And I feel super lucky here, and the leadership at the Florida Dental Association has been so supportive and so open to trying new things and letting us kind of reach out a little bit. It's been great. So
maybe
I've been lucky there.
Here's the push that I will say. In conclusion, if you're in the leadership, we're going to push you, the leadership in organized dentistry, try different things, see what sticks. Get out of the mindset of this is the way we've been doing things. I don't want to hear that. I don't want to hear that at all. Times change. We're in a different change. You're going to get passed over if you don't change things. Was I a little too passionate there?
Hashtag
I don't know.
Change.
Hashtag change.
We don't have enough time to wait for a focus group and research groups and 10 years of studies to make a decision.
Tell me about it.
We have to sometimes go with our gut a little
exactly.
bit.
And there's so many issues that are going on. There's so many places that we can make a difference. One of the things I'm very passionate about on the regulatory side of the equation with the state board, mental health issues, substance abuse issues, that's always the most difficult, challenging thing that really just tugs at my heart when we have to look at, taking away someone's license or getting them in a recovery program. Yeah. That's a perfect spot. I know both Steph and I are trying to work with some of the branches within the ADA on what they're doing for wellness. We got to try different initiative. Things. The wellness initiative, we're actually having a couple of them are coming with us on our Ukraine mission trip that we're taking. So we're gonna build some relationships there, I think, with some of the ADA staff. But try different things, see what's gonna make sense.
That sounds great.
All right. Well, listen, thanks again, Drew. We love you. We love what you're doing in Florida.
It was super cool to have you on today.
It's been great. I could talk to you guys for hours.
Oh, look at that.
All right, man. If you like what we're talking about, please hit the subscribe.
Thanks, guys.